So much for joining us here in San Francisco. I can speak for everyone at Dance Safe and the rest of our conference partners when I say I'm overwhelmingly excited to finally bring this sort of event and discussion to North America. So, in this room, we have folks from all over the world representing 20 different countries. We have those of you who attend events, to those of you who book and organize events, to those of you researching ways to make them safer, to public health officials working to implement health policies and practices, to us field workers at the events providing harm reduction services. And we're all here because we recognize the need. And not only do we recognize the need, but we recognize that this is our community. We're here, most of us find a sense of identity and a lifestyle, and we recognize how valuable that is. We acknowledge that at times it can be harmful, it can be dangerous, it can be scary, but despite all of that, the positive that it can and does bring are way more important. To get a feeling for the past, present, and future drug trends within our broader nightlife community, make sure to stick around for our first plenary session following this session. Club Health has been happening in Europe and Australia for about 15 years, and the very first Club Health conference took place in Liverpool in 1997. And it happened at the world-famous Cream nightclub. Following the success of that conference, we made the decision was made to make the event international. And the next Club Health conference was in Amsterdam in '99. Nightlife has been more widely acknowledged, and we should have some sensible solutions. So here we are, 2013. Club Health finally aims to extend its global reach by holding the conference in North America for the first time. For that reason, our two plenary sessions tomorrow will focus on nightlife management in the U.S. and planning large-scale events. So the nightlife and electronic music communities are growing in North America in ways that make it impossible for us to ignore. Particularly in the U.S., we've seen this expansion and growing interest, and it's been driven by a crossover between dance music, hip-hop, jam, bluegrass, reggae, and even metal. I mean, Korn's last album was produced by Skrillex and a few other dubstep artists. And even the fact that we have dubstep is an indication of this expansion. Now there are close to 100 or more subgenres of electronic music, and there's been this peak interest in outdoor music festivals, some that are fully dedicated to electronic music, and some that have a blend of both, where it's this different genre of music during the day, and then it turns into a rave at night. And it's transitioned from this underground rave scene to this massive mainstream music community. And it's been so popularized that our at-risk youth for drug use are attending these events and hearing about the drug use occurring at these events through media sources. And really, nightlife is the same all over the world. What do? You get ready, you go out, you socialize, you usually get intoxicated, and maybe you add someone sexy. So that's exactly one of the reasons why we planned a whole plenary session on Thursday, focusing specifically on preventing harm and promoting positivity related to alcohol consumption and sex. It's important we come together to meet our counterparts from around the world and learn from each other. This event is a place to connect with each other. We hope you use it as an opportunity to connect with us at Dance Safe, as well as all the other amazing folks around you that were able to make it out. We're here to exchange information on the latest research, policy, and practice. But most importantly, we're here to start building a solid global network, one that aims to change the way in which venues, events, policies, and procedures are structured and carried out. We can and we need to work together to establish widespread acceptance and adoption of proactive and effective health promotion, prevention, and education within the greater nightlife community. So from Dance Safe and the rest of the conference partners, let's do this. One more thing, just a few housekeeping things. The bathrooms are located in the lobby to the right as you come in the entrance of the hotel. Also, San Francisco law states that all public buildings would be smoke-free, so this is a smoke-free hotel. However, when you exit the hotel on your left, the far left, you'll see an ash can for your butts, so if you do choose to smoke, please use that. Let's not litter. If you have any questions throughout the course of the conference, you can visit the registration table that was up front to the right when you walked in the front lobby. You can also seek out any person that has a pink sticker on their badge. They should be able to help you. Or any Dance Safe volunteer. They'll all be wearing a volunteer lanyard as well. You can also ask Ms. Stephanie Jones anything you may or may not need. She's fabulous. And one last reminder, don't forget about our reception this evening following the opening session. And tomorrow night is our social event at Monarch Bar, and that's located at 101 6th Street in Mission, and that's actually right in the back of your program book as well. So you can find that there. And now I'd just like to take just a moment to introduce Ms. Marcia Rosenbaum from the Drug Policy Alliance. She founded the San Francisco office in the Safety First Drug Education Project at the Drug Policy Alliance. She's a former National Institute drug abuse researcher who conducted the first federally funded sociological study of MDMA in 1987 and co-authored The Pursuit of Ecstasy, the MDMA Experience in 1994. She also hosted a conference on MDMA and nightlife here in San Francisco 12 years ago. Marcia.